Hi, everyone. I'm Dr. Ashley Bassett,
And I'm Dr. Catherine Logan.
and welcome to Overtime with the Sports Docs. On each of these mini episodes, Catherine and I chat about a new article or new surgical technique in the field of sports medicine. We'll give you our quick take on the most recent data and how this data will impact our practice. Today, we're diving into a paper that reviews the long term outcomes following arthroscopic Bankart repair and challenges some of the historical narratives around this procedure.
The study that we are reviewing today is titled Long-Term Outcomes of a Contemporary Arthroscopic Bankart Repair Technique in Patients with Traumatic Anterior Shoulder Instability, a minimum 10-year follow-up. This is a minimum 10-year follow-up study looking at modern arthroscopic Bankart techniques using at least 3 anchors, and it asks, are recurrence rates still as high as we've been taught?
So let's start with a bit of history. In the early days of arthroscopic Bankart repair, this procedure was criticized for high recurrence rates, up to 37% in some studies. However, it is important to look at the details. These numbers often came from older techniques, inadequate anchor constructs, and inclusion of patients with significant bone loss. So, this study sought to update the current literature on arthroscopic Bankart outcomes. The authors asked, what happens when we use contemporary technique, proper patient selection, and exclude critical bone loss?
All right, let's dig into the details. So the authors evaluated 181 patients, 182 shoulders, who had surgery between 2005 and 2014 with a minimum 10-year follow-up and a mean of 13.8 years. So of note, the following patients were excluded. So patients with glenoid bone loss of greater than 20%, off-track Hill-Sachs lesions, those with multidirectional instability, repairs with fewer than 3 anchors, and patients who underwent additional stabilization procedures.
So, this is a pure soft tissue instability cohort with appropriate indications, and the primary outcome was recurrent instability. Secondary outcomes included various patient reported outcome scores and rate of return to sport. So, Catherine, what did the authors find?
Okay, so the authors reported a recurrence rate of 20.9% at nearly 14 years, so not 37%, but still not insignificant. Even with modern technique and appropriate selection, 1 in 5 patients had recurrent instability over the long term, so that's pretty important.
This study also found that age greater than or equal to 20 years increased the recurrence risk, and this finding was statistically significant. So, it's clear that our younger athletes remain at higher risk of recurrence.
And this aligns with what we see clinically. Teenage athletes have higher activity levels, they have higher exposure risk, and possibly greater biologic laxity.
So, what about surgery after the first dislocation versus after multiple dislocations? Well, the failure rate was 13.8% after a first time dislocation and 24.2% after multiple events. This was not statistically significant, but obviously clinically meaningful.
Yeah, so that's nearly double. So even though the p-value was 0.108, the clinical trend is pretty clear. So what about timing from injury to surgical intervention?
Well, there the authors found that timing impacts outcomes as well. A shorter interval from first dislocation to surgery resulted in better clinical outcome scores, including the SSV, WOSI, constant, and ROE scores, as well as less pain. Interestingly, recurrence rate remained unchanged.
So super interesting. So early surgery didn't necessarily reduce recurrence statistically, but patients felt better and functioned better in the long term. So this suggests recurrent instability may cause cumulative damage to the joint and affect subjective outcomes. So, all right, let's talk about our favorite part, return to sport.
So, when the authors looked at return to sport data, they found that 97.6% of patients returned to sports following arthroscopic Bankart procedure, and 69.6 returned to their pre injury level of play. So, that's strong return to play data. So, how should all this data from this study influence our practice?
So I think for me, arthroscopic Bankart, when it's properly indicated, has acceptable recurrence. So it's got excellent functional outcomes, and we're obviously seeing strong return to sport rates, but recurrence risk is super real. So anything, when you're dealing with athletes who are less than 20 years old, or if they had multiple preoperative dislocations, these are the patients we just really need to talk about with the risk. What about you, Ashley?
Yeah, exactly. It's all about counseling. And I'll add to that counseling discussion that timing really seems to matter more than we think.
Yeah.
While recurrence rates were similar, patients who underwent surgery sooner after the first dislocation had better shoulder function long term. So, this suggests to me that repeated instability may lead to a host of shoulder issues, including subclinical bone loss, cartilage wear, capsular attenuation, and or neuromuscular adaptations. So, even if recurrence risk doesn't spike dramatically, joint health may still decline. So then the age old question, should we operate after the first dislocation in young, high risk athletes? Catherine, what do you think?
Yeah, I think it kind of reminds me of the patella,
Yeah,
when you start to just think about all the damage that we're doing to the joint. And, as much as, okay, can you wait another dislocation or two? And we're always thinking about, where are they in their season or their recruitment, sort of strategy. But, I think it really strengthens the argument that we have to think about early surgery, for contact athletes, for collision sports, athletes less than 20, and, certainly if they're having that early recurrent instability.
absolutely. And this paper really solely focused on soft tissue Bankart, but let's not forget the other
Yeah.
aspects of shoulder stabilization surgery. So those high risk patients that you just mentioned, they not only benefit from early soft tissue stabilization, but also those adjunct procedures such as remplissage in the presence of certain risk factors. And I think for me, this really reinforces modern instability thinking. It's not just Bankart versus Latarjet. It's individualized risk-based stabilization that exists on a spectrum.
Yeah, I love that. I think that you said that very well.
Thank you. Well, thank you for finding this paper. It was really great. I think really awesome
Yeah.
discussion and really important to revisit some of the older literature we have and make sure that it's up to date and current on what we're currently doing.
Yeah, good point.
Thank you for listening to our overtime chat today. We hope you enjoyed our conversation. Make sure to subscribe on Apple Podcasts, Spotify, Amazon Music, or wherever you get your podcasts to stay up to date on all things sports medicine. You should also watch us on YouTube. If you like what you hear, please consider subscribing and leaving us a review. You can also reach us by email at thesportsdocspod@gmail.com or find us on Instagram at We Love Your Feedback.